Today we're going to discuss your newborn. We'll talk about sleeping, feeding, and those little things your newborn does that seem worrisome but are absolutely normal. Many people are surprised to learn that their newborn can sleep many hours without feeding right from the very beginning. There's no need to wake a sleeping baby to feed them, especially at night. If your baby gets a good few hours of sleep, they'll wake up much more alert and be much quicker feeding than if you wake them. In general, if you're breastfeeding, it's better to feed on demand right from the very start instead of trying to put your baby on a schedule. Sometimes newborn babies taking the breast will feed as often as every hour for several hours. This is something called cluster feeding. However, if your baby seems to be eating every hour all day long, you may want to talk to your pediatrician to see if there's something else going on. Pumping often complicates matters. We all like to know exactly how much we're giving to the baby, but many times when you pump, you actually produce less milk. It's best to try not to supplement. If you let your baby decide how often to go on the breast, your brain will then realize that you need to produce more milk.
Parents often ask, should I burp the baby and how? When you come out of the hospital, oftentimes many nurses have taught you several different techniques of how to get the baby to burp, and they get these large, big belches. And then parents feel nervous when they can't do it themselves at home.
It used to be that pediatricians recommended to burp babies vigorously after each feed, and this has fallen out of fashion. It's not necessary to burp your baby after feeding. Why? Because if there's air, it's just going to come up without you banging on the baby's back.
Many breastfed babies aren't, in fact, ingesting a lot of air, so sometimes there's no air to come out. If there is, it will come out from above or below, and there's no need to force it.
When you come in for your newborn visit, our goal is to help you understand all the unusual behaviors of newborns so that you feel comfortable at 3 in the morning as opposed to worried about something.
Newborn babies do a lot of strange little movements. They have reflexes where their arms shoot out to the side suddenly, and they also often pull their legs up to their chest and grunt and scrunch up their face. Try not to think of this as pain or discomfort. This is just your baby getting used to moving.
Now that you're not getting any sleep and constantly with your newborn, you're going to notice every little mark on their skin. And they have a million little rashes in the first month. You're going to have baby acne, dry patches, maybe even a little diaper rash. But really, those aren't going to be concerning. For some reason, parents are usually very concerned about your child's umbilical cord that's drying up. It's really just gross. It stinks, it's going to bleed, it's going to ooze a little bit, but it doesn't hurt them and it'll eventually just fall off.
As long as there's no redness and swelling around the site of the belly button, there's nothing to worry about. Many people are surprised at the amount of sneezing their newborn does. They ask if it's an allergy to their cat or something else in the home. In fact, it's a reflex, and it's nature's way of helping them keep their nose clear. In the very beginning, I often tell people just to monitor wet diapers. Babies have to pee, and if they are peeing, you know they're hydrated. If you're getting at least 3 or 4 wet diapers a day, that's enough. Stop counting.
When it comes to swaddling, it can go either way. If the baby seems like they want it and they feel more comforted by the act of swaddling, then go for it. But at the same time, there's absolutely no need.
Sometimes swaddling can help soothe your newborn in those really difficult moments. But in general, if your baby is calm and content, it's best to let their arms and legs free so they get used to that movement. Pacifiers can be very helpful in the first few weeks when your baby doesn't know how to soothe themselves. However, it's much better to try to get rid of that pacifier as quickly as you can and use it only in those moments where you really need a little help. Most places in the world, a baby is born and they slap the baby on their back and off they go. Your newborn is meant to go where you go, whether that's Whole Foods or the coffee shop down the street. Just wash your hands and be smart. Your newborn's not likely to be rolling around on the floor and playing with toys with other kids, so it's absolutely fine to have your friends come over and bring their kids and have everyone around the newborn baby. Again, it's all about hand washing.